Hello all, welcome to a new episode of Getting to Know NILP. I am your host, Mark Wheeler, Multimedia Production Manager for NILP. For those of you who may not be familiar with us, we are the Northeast Independent Living Program, also known as NILP, and we're based in Lawrence. We are a consumer-controlled independent living center that provides advocacy, programs, and services to people with all disabilities of all ages who wish to live independently in the community. We are a 501c3 nonprofit organization that receives funding via the Commonwealth of Massachusetts, along with some federal funding, in addition to our own fundraising efforts. Our independent living philosophy states that individuals with disabilities are the best determinants of their own needs and service choices. Through role modeling and peer counseling, we help to empower people with disabilities to make changes in their lives and to become more self-sufficient and self-reliant. At NILP, we really are a community of people who, like our tagline states, we're peer-to-peer resources for people with disabilities. We work every day to create an all-inclusive environment, free of communication, attitudinal, economic, and architectural barriers for all people with disabilities, whether they have visible or non-visible disabilities. Today on Getting to Know NILP, I'm very happy to have as my guest the CEO, Chief Executive Officer of NILP, Matt Pellegrino. Welcome, Matt.
Hi, thanks for having me.
Okay, it's great to have you here today. And I'm here to get your thoughts, and for our viewing public too, about NILP and overall perspective of what our organization does and the work we do to serve consumers in the community, in the region that we serve. So Matt, first thing I'd like to do, if I could, is really when I get into your thoughts about running this organization, really, but first I would like to learn about your professional history, professional work history, I should say, when you came into our organization as our new CEO, a relatively few months ago, actually, replacing our former CEO, June Savageau, who retired at the end of this past June and had after serving 15 great years with our organization. So if you could, please tell me about your history and what led you to become CEO of NILP.
Sure. Well, I started working at NILP in 2006. I actually worked briefly after college at another independent living center. So that's how I knew about the network of centers for independent living. As you can see, I'm also a person with a disability myself. Mm-hmm. So I thought when I graduated from college, I tell everyone I didn't really, at that time, didn't still know what I wanted to do really. I was thinking about journalism maybe. I was thinking about some other things, a history teacher. I'm a big history fan. But I thought, I know about the different system of services for people with disabilities from my personal life, so I thought I would, and I had remembered independent living centers because I had worked with NILP actually in high school as a consumer. So I thought this would be, I can do this job. So I ended up, again, I came to NILP in 2006 as in our PCA program, our personal care attendant program, as a skills trainer, which is, an entry-level position at NILP. So I met with persons, and at that time we were much smaller, so I think we only had about 30 staff members at the time, and I worked in the PCA program, but I also helped persons with non-PCA skills training as well around benefits, housing. So a few years after that, I was promoted to different positions, leadership. So a team leader at the time, a senior skills specialist, and then we had an opening with the director of the PCA program. So I was promoted to that position, worked in there for a few years. At that point, that was about 6 years after I started at NILP. I took sort of a sabbatical, I like to say. I left NALP to see what else was out there.
Right.
For a few years, I worked in the managed care organization in Boston around disability, but it was different, and I really missed the independent living philosophy and really our mission. So I came back to NALP as the director of long-term services and supports, which sort of oversaw the PCA program along with some other programs.
Right.
I did that for several years. After that, June would sort of move me around to the different programs that were starting up at NALP. I worked in the community partner program most recently when we had our Lowell office. So I was there for about 5 years. And then obviously June announced her retirement earlier this year. She encouraged me if I wanted to go for the position. I ended up, at that time I had really low expectations in terms, I thought I would go through with the interview and see what happened and sort of learn from that process, but it went really well for me, and I was appointed as chief, I hate this title, I say it all the time, as CEO. I think of myself as the director of NALP, so that I was appointed to that position in August.
Well, that's the title as it used to be. I think in June's earlier days, as I recall, then it evolved into CEO.
Yeah, certainly.
Wow, that is just terrific. And I didn't realize that your history went that far back, even to high school and everything.
Oh, yeah, as a consumer.
And I can tell you, I remember when I started back in 2012, you were involved with the PCA program. You were one of the very first people that I met then. And I think even at that time, we only had around 30 people, and we're around 100 now. So the growth has been incredible. So it's great to be a part of this still somewhat small organization, but truly growing over those years and everything.
It certainly is.
And I'll also say your familiarity with NILP over all these years and our growth. You know, once I found out that you became CEO, it was great. I thought, well, there's no person who knows our organization who could be better placed and suited as you've grown with our organization than Matt Pellegrino. That's what hit me right away. So it's great having you as part of that and everything. So Matt, to get into the questions I have, so I'm curious because things change. From our great previous CEO to your vision and thoughts about NILP as an organization. So as far as being leader of NILP, what is your management philosophy? And by asking you that question, how do you give direction, inspire employees? That's an important part of leadership, and lead and motivate the team.
Sure, I think one of the things as a leader is that you really do have to lead by example. You can't ask the staff to abide by processes or rules that you don't abide by yourself. So I try to show up on time every day. I try to really be a presence with the staff. So we'll walk around the office. I'll talk to some of the different programs. Right now, I'm really trying to get to know some of the programs that I haven't been that involved in the past. I think of myself as being at NALP for such a long time, but you can get siloed at times within your program, get sort of that micro thinking with what you're doing from day to day. And so we've always tried in the past to sort of break down those sort of walls between different programs because we're doing the same type of work, regardless of what types of services we're providing, it's all in the same mission. So, and a lot of times the consumers sort of overlap in different programs. So really, it's just communicating with the staff, communicating with staff at all levels of the agency so they can get to know you and I can get to know them. I think when they see you being honest and just being yourself, I think the staff tend to want to work harder for someone that they trust, that they feel is valuing their work. So that's what I try to do.
Trust is an important part of the process, and it's great to hear you say that. And I think what you said earlier is absolutely true. We tend to work in separate silos, if you will, through our various programs and services, but we're all working towards the same goals all together
Right.
as an organization.
Definitely.
So that's really key. So as we look towards the future in our planning and our growth, we do have a strategic plan. And I'm curious to get your thoughts about our strategic plan over the next 5 years. For you as CEO, what are the strengths, weaknesses, and areas of opportunity that you envision? And what helps you achieve these goals?
Yeah. So right now, our strategic plan is based on a few different areas. Not to get too much into the weeds on it, but it really
Right.
is around expanding our presence in our service area. So I talked about earlier, we used to have an office in Lowell. We ended up sort of closing that for different reasons, but we want to sort of expand into those cities outside of Lawrence. We've been in, our headquarters has been in Lawrence for as long as I believe the agency has existed, but in sort of that, because of that, your consumer base is very heavy Lawrence in consumers in this area, but there's Lowell, there's Havel in our service area, there's Newburyport. These are all areas that I think we're going to look at really getting back to and seeing what works for our consumers mostly. You know, how does our presence help them in that area? How can we make it more convenient for them to meet with our staff? We've taken on more programs over the past 5 or 10 years during June's time, and that's caused our service area to sort of even expand outside of our normal ILC service area, which is, you know, generally the Merrimack Valley, but certain programs do require us to go outside of that, you know, more onto the North Shore, down towards Boston. So it's helped us expand our presence with consumers, but it also can be tough on the staff to travel out there. So we want to look at different ways that we can make it easier for our staff to provide services to all the areas that we provide to, as well as what works for our consumers and what they need in those areas. So that's one part of the strategic plan. Another is around the recruitment and retention of staff. It's been tough for everyone, I think, since the pandemic especially. This is a tough field for staff to work in. It's a high burnout rate because of the type of work that we do. But we're looking at different ways to pay competitive wages within our industry, and really benefit packages for staff that make it incentivize them to stay with us and see NILP as a long-term career, as opposed to maybe just starting out in the field, you know, to gain experience and then move on to other things. So that's something we definitely want to do as well. And then also we're looking at our IT infrastructure and operations to see if we can make services more efficient for the consumer, and again, going back to the staff, make it easier for them to do their jobs with some of our technology that we have. So those are some key areas of a strategic plan. It's not going to be easy. Sometimes you set goals and the reality sets in, but I think we can achieve a lot of those, particularly around serving underserved populations and expanding our service area.
It can be challenging work. I know that all too well, because you want to give the best localized work in the communities that we serve.
Definitely.
And it varies from consumer to consumer on their individual needs. It can get very intense, and you want to serve them the best you can. And technologically, that's important too. And just to get through the pandemic, we certainly had to adapt and be flexible and try new ways of meeting and serving our consumers, and let alone having the communications with each other that were required.
Yeah, that's a great point, and that's just one way that it's changed in the past 3 years. Just it used to be you're doing conference calls all the time. Now we're still seeing people in person, but not in the same place. So, but we can use that technology for a consumer that can't maybe make it into a center. That if we can't make it out to them for one reason or another. And you know, Mark, we used to have a policy in place or a procedure where we would close down when it was heavy snow in the area.
Oh, yeah.
Now we can, because our staff would have, be danger for them to travel out into the community. Now we can continue working from home in a way, so we wouldn't have to lose that day. So that's just one thing. I know, not to get too much into the technology, but I know
it's important.
Yeah.
So it's good that you're going over this. Yeah.
And some of the staff in the past, we'd take out our notebook and paper and pen, but now we can take out a laptop to the home and look for services with the consumer on the computer with them. These are all things that have improved in the past 4 or 5 years at NALP, and I shouldn't say thanks to the pandemic, but it's really forced us to look at things differently.
Yes, we all had to learn and adapt,
Yeah.
and thankfully we've come about very well through all those areas doing that. So that's terrific. Now, Matt, I wanted to get a little bit into fundraising and everything. Of course, we receive funding, but to serve all the consumers and more that we'd like to, our fundraising certainly helps us a lot. Obviously, one of our big events is we have an annual golf tournament, which helps us, and we do other things to help fundraising. So please tell me about your feelings about fundraising overall and the importance of that for NILP. I'm really curious about, what do you feel are the keys to successful fundraising in your estimation?
It's fundraising is important for a nonprofit, but I think it's been a challenge in NALP because I don't know if centers for independent living or independent living centers, whatever you want to call us, have a great sort of I don't know if we're well known out there as a resource in the community as we should be. We always say we're sort of a hidden gem in terms of our services and what we do. We don't usually have a lot of eligibility criteria for our services, if at all. Someone just has to identify as a person with a disability, and they can generally receive services from us. So I think that's different than a lot of other organizations out there that might have more stricter eligibility criteria. So another director was telling me recently that, when you say independent living center, the response you sort of get from people is, oh yeah, I know what that is. I just put my grandmother in one of those. A little, that's not what we do. It might be a better way to sort of brand us as a center for independent living. So we are, as you said at the opening, an advocacy organization at heart that assists people with disabilities that live in the community, in their homes. When we don't have residences, we don't have. It's not a place where people live. It's really an organization for peers. People with disabilities, over 51%, helping other people with disabilities accomplish their independent living goals. So I think, back to your original question about fundraising, Mark, I think a lot of it is that we just have to tell our story and how unique we are to those that are willing to give, and show our success stories. And I think, we don't want to be seen as a charity. We want people to think, yeah, we like what they're doing, and we want to be a part of that. So that's really, I think, if I can do that, over the course as I go along here in the leadership role, that's what I'm going to try to do, and hopefully that'll pay off.
That'll be great. I think our message, and of all the successful consumer stores that we have, that's the best way to tell about the work we do to the communities that we serve. And what you said about independent living is so true. That's become such a co-opted phrase. It could mean anything from retirement homes and so forth. So it's kind of a word where the intention where independent living center was made, people have kind of taken that term and used them in other directions. So there is some confusion out there. So
yeah, and we want people to live in the least restrictive environment that of their choosing. That's really what it's about. If that's an assisted living that someone wants to go into, that's fine. But we're looking to keep people in the community if at all possible. And I think part of that is a lot of people aren't educated on the services that are out there, not through any fault of their own, but because it's not a good outreach system probably. And I think part of our job is our staff's job, and regardless of the program they're in, is to teach people about what resources and services are out there, so that they can make those informed decisions, and they can know if there's an equivalent service in the community that they might go into a long-term care facility to receive when they could receive it at home, like the PCA program, like adult family care. These are programs that really help people live in the community and remain there if possible.
And it's really, we spend a lot of time in advocacy and educating our consumers too. They may not know all the resources that are available to them, so we help guide them through that whole process too. So what you just talked about really kind of is part of the next question I'm asking you about, because these are the things you like to do to convey the message about the work we do. But to be a leader, and what qualities do you think are required to be a successful leader for NILP?
I think at NILP, at any place, I think a leader is someone who's willing to listen to others, willing to not always be the smartest person in the room. I think it's sort of a misunderstanding that someone who's a director or someone in any management position is always the expert on what they're managing. You have to listen to others and hear their perspectives. And I really try with the directors at NILP. We have a great team. We have a great staff to really listen to what they think will work, because they're the ones that have boots on the ground. I think, my background as being a direct service worker for many years can sort of help inform my decision making when it comes to how we're structuring our services, and also as a consumer myself. I think that's very important. I think that's a strength of mine as a leader at NILP, that I've seen the services from all angles, as a consumer, as a staff, as a manager. So I think that's what I try to do in terms of my leadership. But I think, honesty, integrity, all those things that that you think of in a leader, I think is good for NILP and any leader out there.
I think it's good, to what you said, to really be open to the possibilities, to get different people with the staff and their perspectives on everything, and come up with a thought, because there may be new directions that maybe you didn't have to thought about, but at least you're open to the possibilities and entertain what they say, and I'm sure there's great ideas that come out of that too as a result.
So. I definitely think so.
Yeah. Yep. Oh, that's terrific and everything. And then part of that in the decision making, we do have a board of directors, and I'd like to get your thoughts about this, about the importance of having a board of directors and how that helps toward working for the success of NILP. What do you see, Matt, as the role and value of the board in your success as CEO?
Well, our board in particular is one that has to be 51% persons that live with a disability, and that's I believe unique to our Centers for Independent Living, and I think that means that they're stakeholders in our services. We're not putting we're not necessarily putting people on our board that have strategic partnerships with us like other organizations. We want our consumers on our board. We want people who understand how important our services are to the lives of people with disabilities. So I think if that's what I'm going to take anything from the board in their direction, it's that these are people who really truly understand, because of their lived experience, why Centers for Independent Living are so important to the disability community. So I think that's they've been so supportive of me since the start. I had some contact with the board previous in my previous positions, but not too much. And I think certainly I'm getting to know them, and they're getting to know me a little bit more than just the interview process. But I think so far they've had some great suggestions about the way our operations, and I'm willing to listen, as I just said in the previous answer. Like, I listen to all perspectives on it, and I know that I have their support. So I think it'll be a great symbiotic relationship
I couldn't agree more, and I think it's important to note, as you pointed out again, that the board, like NILP, it has to be a minimum of 51% of people with disabilities who are a part of that process too. And it's also important that the board members really reflect the communities that we serve in the population, I think.
Yes.
Really to have that perspective from
Absolutely.
that side as well. I think that's important. So you've been with NILP for a long time, and this is kind of a question, maybe, I hope it's not putting you on the spot. What's one thing, or maybe more, that you would do differently for this organization that may have not been done previously?
You know,
No, that's not easy.
that's a tough question. This,
Yeah.
this is why they call you Mike Wallace at the office, Mark. No.
Yeah, I want to know. Then sweat on the upper lip and so forth, as Mike Wallace used to do in those 60-minute interviews.
No, I think, you know, I don't want to repeat myself, but I definitely think if we can do better with the outreach for NILP in the community, and I know one of our programs is, several of our programs, but one in particular I know has been monthly taking their staff out to visit with different community organizations. Sort of, I look at it as our partners, because a lot of times we're working with a lot of the same people for different things. But sort of introducing us to them and them to us about what our services are. And I think that is one way, you know, that'll help us with getting people to understand what an ILC is. Just like they might know what a nursing home is, or what an elder service provider is, or the ARC system. I think getting them to know what an ILC is something I want to do through our programs, through outreach. We're sort of looking at our presentations that we can do to make them better when we're just talking with different partners in the community. So that's one thing. I also think, you know, I'm working with a longtime employee, Jim Lyons, and our Vice President of Advocacy and Community Development, to really develop relationships with our local politicians and leaders, so that they can help us in a way, and attend our events and get to know our consumers and staff, so that we can assist them if they ever have constituent outreach, but also they can assist us with funding priorities and things like that. So I think those are two areas that we've tried in the past, but we definitely want to prioritize, I think, moving forward, so that we have a seat at the table when it comes to the lot of changes that are happening in the health care delivery system these days.
Yes, and I think what you said, first of all, it's very important to go out and meet other community organizations and meet the people there too, and really get the word out about the work we do, because you're right, it's just getting that message, and maybe not as many people as we would like know about us. So I know, for example, our community supports team getting to homeless shelters to talk to the staff and the people there, just to letting them know about it.
Yeah, and you know, I think when people think of different areas like housing, like benefits, or like vocation, they might think of certain places.
Right.
But we do it all. You know,
Exactly.
we really do it all at NALP. We receive a lot of referrals from different housing agencies that help take some of their consumers that are having difficult times, particularly those around disability, either around accommodations at their residence, modification funding for assistive technology in the home. We're also doing housing search. Housing, the transition is a core service of ours. The transition from a facility, a hospital, back into the community, helping consumers purchase furniture. So I think those are, it's getting people to understand our services and what we're doing, and see us as a resource like they see others in the community, I think is something that's important.
That's so important, and it's important so all our viewers know too that we truly serve the entire population, all economic strata,
All
across
disabilities.
the board.
We're not focused on any particular disability,
Exactly.
across disability organizations. So it's important to say thank you for saying that, Mark.
Yes, we will help guide our consumers to the kind of services they need, whether
Sure,
it's through us or
if
it may
this-
be elsewhere,
yeah.
but we will find that help that they need. I think
Absolutely.
that's so key important. And just so everybody knows, all our services and programs are free. So that's also important to note that our viewing audience may not be aware of. So
Yeah, and I just want to mention that when you were saying if we can direct them to other places, we have a partnership with AgeSpan, which is a well-known elder service organization in the Merrimack Valley and the North Shore, so that there's sort of a no wrongdoer policy. If they receive a referral that they think can be helped better by NILP, they'll do a warm transfer over to us. We're very familiar with the staff at AgeSpan.
Oh, yes.
Good friends of ours. So that's just one way that we can sort of provide that information and referral if needed, which is another core service of ours.
And that's just one area when you were talking about them. They do serve the aging population for the most part, but we serve all ages, certainly that to very young ages,
Yep.
to all ages,
Absolutely.
really. So that's important. So Matt, I wanted to ask you, and this happens often with CEOs, they often find themselves working the rooms, so to speak, or networking at a gala event, so forth and everything. What is your personal approach for those kind of situations? I know if you were to sit there and describe our entire organization, what we do, that can be tough. So how do you condense all that when you're maybe meeting different people and put it in a short thing?
Yeah, I don't know if anyone would would see me as working the room. I'm sort of, I think people. I'm a man of what's it called? A man of few words.
Man of
at
few
times.
words, yeah.
But it's something I'm trying to change a bit in this new position. I have to be a spokesperson for NALP. I've always done a lot of listening to others, but usually less talking. But I think one of the, if you had to condense our message, I will always bring up the fact of our staff that are peers, that our board are peers. This is not always the case for other organizations that are providing services to the same demographic that we do. And I think I know this for myself as a direct service worker, when you go out to someone's home and you're using a wheelchair and they're using a wheelchair, you have that instant credibility that other human service workers unfortunately don't have. They might have great intention, they might be really great at their job, but they don't have that instant credibility that a peer would have when they go out to their home and say, yeah, I know how you're feeling. I know how difficult it is to get your wheelchair fixed, and work with these insurance companies and who are hassling you, and because they don't have an authorization or your doctor didn't send something over. We understand how that feels to be without really your legs for a week or two. So I think that's what I plan on telling people if they ask about NALP, and really pushing that sort of theme that
Right.
we're peers, that even if even on some of our staff who don't necessarily have a disability or a visible disability themselves, they often have close family and friends. There's a reason why they got involved with NALP in the first place, because they do have that close contact with someone who has lived experience. So I think that's really what I would try to sell in a way, if I were talking about our organization to others.
Right, and when you're talking to people out there too, it's just an intro line and just, well, this is kind of basically what we're about, but you want to open the door for any questions they have, which you can tell them everything about what we do.
Yep.
And as far as the peer connection, that is so vital important, and that's when you can truly work well with a consumer. If you have a disability as well, or you have the experience of somebody in your family, or somebody you know who has a disability, you can get that. I always think of a great example of William, who works in community supports at our agency, and he was talking with a consumer on the phone and everything, and that particular consumer was a bit skeptical. It's kind of like, well, how do you know about me and my disability? And William invited him to come in and meet with him and so forth, and he did. He came in, and as soon as he saw that William was blind, all the skepticism melted away. He just saw him as, here's a person with a disability. He can understand what I may be going through.
Yeah.
And he related to him very well, and they had a great relationship from that moment going on forward.
Yeah, and the unfortunate part is a lot of consumers in the disability community have had negative experience with the healthcare field for one reason or another, and that's sort of informing their thinking when someone else is coming out to their home. But I think you're right. I think seeing a peer, seeing someone who understands their situation and they know that they do, I think that makes a huge difference.
Makes an area of comfort for them, and they can, that the fact that they can relate and really talk down, because we're building relationships with these consumers too, and making them work.
And it can take a while to do that.
Oh, absolutely! It's not an easy process.
It's not always happen at the first meeting. We need to build that trust with them. So
that takes a long time, and when you work with a consumer, for example, to get into housing options, that can take a long time to get them to the place they should be and want to be.
Could be years long, absolutely.
Oh, absolutely, yeah, no doubt about that. Okay, so Matt, you've been really thrust in this position as a CEO. I'll say that because it changes, and all of a sudden you're shouldered with all these new duties and everything. So obviously you're very busy as a CEO. That's more than understandable. I really want to find out how you feel personally about controlling your own time. How do you manage, no doubt, your very busy calendar that's come on?
I don't know if I have an answer for this one yet. But,
not yet. It may come apart. Yeah.
It's been 4 months, but it's very busy. Just you're working with a lot of more staff than you used to. They want your time to sort of talk about their priorities. So it's been tough, but I do really try to keep that, not to speak in cliche, but an open door policy at the office. I want the staff to know that they can, that I'm available to them, that I'm accessible, that I'm transparent with information as much as possible. So I think I don't know if I figured that out, Mark. I guess you look at what your priorities are and you try to fit them into your day and then take on everything else. But at some point, I'm hoping to really empower the directors. We have a great leadership team.
Yeah. We
have a great staff, but certainly they're the experts on their programs and what works, and I'm going to let them a lot of times do their thing and provide oversight to that, and try to use my role to look at some of the bigger picture things going on with the organization and how we can go forward. But it definitely, there's so many hours in the day, and I feel like sometimes I'm working more than that.
Yes, but, I understand.
I think I'm settling into a groove, and I know I'll feel a lot better in a year from now in terms of that and other questions that you have than I do right now.
Okay. Well, I know it takes a while to get acclimated to, but what I like is your vision of it, and really kind of a level playing field for all. You're open to everybody. Discuss that, you're very approachable, and we can discuss anything that goes on and everything. And I know in my past I used to work for a couple places where the chief people are up on a pedestal, and it was tough to approach them and everything, but you're just open to everybody and everything, and that, I think that leads to the whole spirit of NILP that we've held as long as I've been with the organization for 11 years. And it's great to continue that and even make it better. So
no, certainly, and even you, Mark, I've been probably interacting with you more in the past couple months than we have. I mean, around our sort of image out there on the social media. So just really trying to get involved in all the different aspects of the program, I think that's how I'm going to learn the most about areas that maybe I didn't know as much, and what you do, and what different persons that are staff at our agency. So I'm looking forward to it.
That is terrific, because I'm in the realm of marketing and development. That's important, of how people view us and how the public sees us and so forth, and to get the word out. We talked about early in this interview, in fact, we were called I think right around the time I started, and I think there was only around 30 people, the best kept secret in the Merrimack Valley. Thankfully, that has changed considerably, and I think our people have gotten to know us that much better, and they will continue to get us to know each better as we get out in the community through all the methods that we've already discussed.
Certainly.
So, yeah, that is terrific. So we have a lot of diverse array of programs and services that we offer to consumers at NILP. What's your assessment of it overall? Is that we really serve all needs, or is there more?
I don't know if there's ever to say we can improve in areas. I think something I always, whenever I'm either interviewing new staff or talking to others about, I'm always explaining that our programs have the same mission, which is to keep people with disabilities in the community. You know, the RLC, the recovery learning community that we have, might do more sort of support group model, you know, groups out in the community. Other programs might do more direct service, one-on-one work in the home, but they all have the same goal. Some might put in place a PCA program, some might help someone to search for housing, but really it's, you know, how can we make you, help you achieve independent living goals in your home, in the community, close to your friends and family, and not isolated somewhere in a long-term care facility. So I think all of our programs right now, you know, share that mission. I also think that we're sort of trying to get involved in different, more managed care with managed care organizations and partnerships with them, which might not, you know, always have our IL philosophy in mind, but if we're with them, if we're at the table with them, if we're on the care team, we can sort of change them from within. That's ideal.
Change that paradigm, you know, and getting in the mix that way.
And I hope we can be successful in that. So I think even those programs which might go a little further from our core services, and maybe have that, you know, we want to talk about our IL model to their clinical model, and we think ours is better, and we can can sort of help inform your workflows and your care model to more align with independent living philosophy and self-direction and consumer control. So I think that's why we're really trying to aggressively become involved with these partners in the healthcare world, so that we can bring our vision to them.
Right, and in essence, we're educating these them as well about that too. I'm also happy you brought up the RLC, the Recovery Learning Community. In fact, the Recovery Learning Community we have housed in our independent living center. Of the 10 independent living centers in Massachusetts, we're the only one that houses a recovery learning community. Specifically, it's called the Northeast Recovery Learning Community. And they really help people who deal a lot with what one may call invisible disabilities, mental health challenges, things of that sort and so forth. So that is great. Yeah. So, Matt, my last question to you too, and it's kind of a philosophical question and everything when you think about it, because you haven't been in the CEO role all that long. What do you feel is the best part and also maybe the worst part of being a CEO?
Well, I think I have to say the worst part. I don't know but I would say the best part is if you're in a position to certainly make an impact like you've never been before, I think. And I think to sort of combine it with maybe what the part that makes me the most nervous is that
which I should call the most challenging
the most
part.
Challenging, let's use
rather
that.
Than worst. I think that probably is better terminology.
But I think you realize, I've realized since August that I'm now sort of really responsible for the entire organization, its history, its the staff and their livelihoods, and decisions that you make could affect all those things. So and that wasn't always, I've been a manager and a director for many years now, but you're in charge of a team of people, and it's you have confidence over that and expertise in that, and you feel you even if you made a poor decision. You wouldn't think like it would affect a great deal. You could fix it, but I think being the director of NILP, it's a heavy burden to take on. And I know June used to talk about how there's sort of a heaviness to, you're always with you. You're sort of on call. Even you're always working when you're in this position. So I think it's a generally an honor to have been appointed as the director of NILP. It's something I take incredibly serious, our history, and really moving us into a great place in the future. So there's I'm really excited about it above all else.
That's why it's great. Now, I've always felt that way about you personally, that's how you like to look at it all too and everything. And you're right when you say June, like it's what she used to say about it being heavy. And I remember June talking about she would be in the shower and just a thought would come to her, because it's always these kind of things are always kind of weighing on you, right? So
that's what I think. That's what I mean by always working. You always sort of even when you're at home watching a television show with your wife, and I have to do that thing tomorrow, and it's always something. But
exactly, there's always something. All right. Well, thank you, Matt. I really enjoyed our conversation today, and I certainly feel that the viewers, you've learned a lot more about NILP through talking to Matt here and everything. So I thank you for that. I really believe that you covered a lot of ground about your thoughts and running this great organization and the consumers that we serve. So thank you for taking the time to do this with us today. No doubt that you have the vision and leadership to help make us a bigger and better organization to serve all the communities in our coverage area in Northeast Massachusetts. So for our viewers, thank you everybody for joining us on this special episode of Getting to Know NILP. Please note that you can call us anytime at 978-687-4288. And also, please do visit our website at www.nilp.org. You can also find us on our social media platforms, including Facebook, X, formerly Twitter, and also on LinkedIn. Thanks again, everybody. Look for us again on another future episode where we will spotlight another one of NILP's programs and services. So have a good day, everybody.